Hi there, my name is Mia and I am a member of a Red Cross and Red Crescent response team. In this video, I will talk about the importance of community engagement and accountability when we prepare for and respond to emergencies. What do we mean when we talk about community engagement and accountability, CEA? CEA is a way of working collaboratively with communities to effect positive changes in their lives through participation and community-led action. Lessons from previous humanitarian and health crises, including the West Africa Ebola outbreaks, Cox's Bazar refugee crisis, and Sulawesi tsunami, among others, have taught us that constructive and meaningful engagement with local communities and trusted leaders is essential for prevention and response measures to be adapted, accepted, well understood, and successful. In our national society, we're using the Preparedness for Effective Response approach to prepare for various types of disasters and crises. In the past years, we have invested in community engagement and accountability approaches and systems in our regular programs and services to strengthen our disaster management capacity. This has already made a difference in the way we work, but it needs to be sustained over time. In my district, we apply 5 steps to reduce risk, prepare for, and respond to emergencies. Step 1. Understand the community. To understand community vulnerabilities and capacities, we use simple approaches such as direct observation and checking already existing information. With the permission of community representatives, we sometimes also carry out assessments, interviews, and surveys. Step 2. Plan with the people. Then we engage community leaders and members to discuss actions that can be taken to manage disaster or health risks and agree on the best approaches to ensure community participation. For example, in my village, we worked together to build a bridge to safely cross the river in the rainy season. Step 3. Two-way engagement. We regularly share information clearly and widely through trusted channels. For example, in my village during the COVID-19 pandemic, we disseminate information to encourage people to adopt safe health practices and reduce fear, stigma, and misinformation about the disease. We also share information on the progress of activities, any challenges the National Society is facing, and always give opportunities for people to ask questions, provide suggestions, or express their concerns. Step 4. Listen, analyze, and act on community feedback. This feedback is key to constantly adapt our approaches to address the needs of people most affected. Also, rumors and misinformation travel fast and can quickly undermine response efforts. Therefore, it's essential to set up systems to regularly collect, analyze, and act on community perceptions, complaints, questions, and suggestions. Step 5. Continue to listen and adapt. We continue to use data for decision-making and course correction. As community knowledge gaps, beliefs and behaviors change over time. Evidence and experience have shown us when we truly engage communities and they play an active role in designing and managing programs and operations, the outcomes are more effective, sustainable, and of a higher quality. We also know that time spent on preparedness leads to time saved when an emergency occurs. Our national societies are present before, during, and after a crisis. As part of the communities we serve, we need to invest in systems to communicate effectively, collect and respond to feedback, and facilitate community participation. And we can.